won't be having anyone that we've lost. But nevertheless, our 2,902nd death is a 77-year-old male from Mingo County. Our 2,903rd death is a 77-year-old male from Harrison County. And our 2,904th death in West Virginia is an 87-year-old female from Monongahela County. I say it over and over and over. I cannot be more sincere. We can't let them just be a number. We just can't do that. If you know these people, call them. Let them know they're not alone. Absolutely reach out. And if you don't, please just keep them in your prayers, as Kathy and I will, and we'll continue to pray that some way, somehow they'll get through this tough time, and we'll continue to be able to move forward. Now, before I go any further and give you the numbers, and everything, the numbers are all good and all that kind of stuff, but I want to read something to you here because we're bringing a hero home. There's this young man, was reported missing in late 1950. The defense POW MIA accounting agency announced that Army Corporal Pete Conley, 19 years of age, from Chapmansville, West Virginia, was killed in the Korean War and was accounted for on June the 5th, 2020. In late 1950, Conley was a member of Company K, 3rd Battalion, 31st Infantry Regiment, 7th Infantry Division. He was reporting missing in action on December the 12th, 1950, when his unit was attacked by enemy forces near and I think it's Chosun Reservoir in North Korea. Following the battle, his remains could not be recovered. On July 27th, 2018, following the summit between President Donald Trump and the North Korean Supreme Leader Kim Jong-un, in June 2018, North Korea turned over 55 boxes purported to contain the remains of American service members killed during the Korean War. They were able to identify this young man's remains that were from Chapmansville, West Virginia. Absolutely, Pete Conley is coming home. He'll be buried on Peck's Hill in West Virginia, and we celebrate this great hero that's coming home. I don't know how it could be much better than that and everything, and at the same time, we recognize for this family their loss, but we absolutely celebrate this family's hero that's coming home. Okay, if we could switch back to our numbers just a second. We have 53 new positive cases in West Virginia in the last 24 hours. Our daily positivity rate is at 1.55. Our cumulative rate is at 4.99. Remember that threshold number of 5%. This is the first day that we've been under 5% since New Year's Eve 2020. December 31st was the last time we were under 5% in West Virginia. Our active cases are 1,026. Our recovered cases are 160,469. We have 74 people hospitalized and 24 in the ICU units. We have no red, no orange, no gold counties. We've got 4 yellow counties. We've got to continue to absolutely push. We don't want these counties, popping up. We were down to 1 yellow county, and now we've got 4. We want to remember, if you're 65 years of age, you're on a way to doing something that is just unprecedented beyond belief. We're on the threshold of being able to have 90% of our 65 and older, that are vaccinated. If you're 65 and older and you have any symptom whatsoever, you need to go get a test. You need to go get a test whether you're vaccinated or not, but especially if you're not vaccinated. You need to go quickly to get a test and everything. And if by chance you were positive, these antibodies would take care of it and everything. And if you don't, and you wait too long, it's going to be a tough road, a really, really tough road. The vaccine eligibility for 12 and older is here. We want to encourage all people that have had one shot of Moderna or Pfizer to absolutely follow up and get your second shot. These vaccines' effectiveness are off the chart. They're off the chart in every way about COVID, but they're absolutely terrific against this Delta variant. Our young people, we need help. We need help with the parents and the grandparents to get our young people across the finish line and get them vaccinated. Now, I want to read you just a little bit here about the Delta variant. It is increasing in our country, and it is more transmissible, and our medical community is going to tell you all kinds of good stuff. They've done it and done it and done it, but the bottom line to the whole thing is this Delta variant supposedly is about twice as infectious, and it is twice as deadly. Now, and it absolutely is tremendously, you are tremendously protected, against this Delta variant if you're vaccinated. Now, bottom line, the whole thing, the Delta variant now has jumped from 12 to 15, doesn't sound like much. It's in 6 counties in West Virginia, doesn't sound like much. But all of a sudden, if this thing really takes off and everything and you're not vaccinated, it absolutely is super deadly. And so I'm not here to alarm you. All I'm here to tell you is just the fact and the truth. How you can take a chance to be walking the streets, no matter what your age, how you can take a chance to not have this vaccine, I'll never understand. I'll never understand it. It's just too big a chance. Yesterday we had a day with Baby Dog and Do It for Baby Dog, and she rode with us, and we traveled a lot of miles, I can tell you that. But nevertheless, we started off the day in Fairmont. We gave away one of our big giant trucks and everything to a man there. His name's James Sanson. And James has worked and still does work for the Department of Education. He does incredible work there. He was shocked beyond his belief. His wife is a nurse with the Department of Education, and they do great work. His wife is Tina, and just a wonderful, wonderful family. It was really neat, really, really good. James drives a bus and has done all kinds of work, I'm sure, and we thank him over and over and over. We left Fairmont and drove to Clendenin, to see a young man. His name's William Harris. We didn't really know a whole lot about the background, and all of a sudden, he's got a WVU, I think, a rifle team shirt on. And I asked him about that. I said, what's this about, William? And he said, that's my alma mater. And he said, I'm a WVU graduate. And I said, well, that's unbelievable. That's fantastic. He said, I'm in medical school. And he's at the osteopathic school in medical school. Unbelievable, just unbelievable. And he was just absolutely shocked. His mom was with him, and just really good stuff. Really, really, really good stuff. Now, we left there and we drove to Princeton. And when we got to Princeton, we had, one of our ex-Senate presidents, Bill Cole, join us, because this lady worked at one of the Bill Cole auto dealerships. And the neat thing about it is she had been there since, I think Bill told me the night before, because I called Bill the night before and told him, that we were coming. And he said this lady was one of 3 that started with him when they started everything. She's been there that long. She's done incredible work. Her name is Heather Coburn, and Heather was, I mean, to say Heather was excited was is an understatement of all time. Who wouldn't be excited? She's probably West Virginia's newest millionaire, and all I can say is for all the folks that are out there that are not participating because they don't register or they haven't been vaccinated or they haven't had their vaccine, I mean, you're missing a whole lot of stuff here and everything. So we continue to encourage, and Baby Dog continues to love everybody and make everybody smile, and so congratulations, James and William and Heather, and thank you, Bill Cole. Bill's such a class act, and he's been such a loyal servant to West Virginia. He loves West Virginia just like I do, and he brought all of his employees there and everything. They had no idea what was going on, and he had gold and blue wonderful balloons and a cake, and some party poppers and everything that all went off when we announced it and everything, and it was. It surely caught this young lady off guard and everything. We're really happy for her. Now with us today, we have two students. We have Devin Dawson from Alma in Tyler County, and we have Paige Stanley from Parkersburg, and both of them have won full scholarships to any school that they choose in West Virginia. Any of our public institutions and everything, we'll pay for the room and the board and the tuition, the books, whatever it may be. And so, but they're with us today. And Jordan, are you going to announce them?
Yes, sir. Devin Dawson from Alma in Tyler County. Devin, if you're on, please say a few words.
Hello. I'm really thankful that I'm given the chance to get this scholarship and have a free, I believe, bachelor's degree so that I can go ahead and make West Virginia better by giving my part to the state.
Devin, I'm telling you, you're great. We love you to death. So proud of you, buddy. So proud and so happy for you. Do you attend Parkersburg High School?
I attend Tyler Consolidated Middle and High School.
Oh, very, very good. Very good. Well, listen, we're proud of you as we can be, and you're going to go do great stuff in West Virginia, and you got a long, wonderful life in front of you and everything, and just know everybody loves you and is really proud of you.
Okay, now we'll hear from Paige Stanley from Parkersburg. Paige, if you're on the Zoom, please enable your video and unmute, and we can talk to you.
Hello. I am very thankful. I didn't know this would ever happen to me. I wasn't expecting it to happen to me, and I am very grateful to have a full ride to college. And I don't know what to say. I'm so shocked. Thank you.
No, Paige, listen, thank you. Just seeing your big smile and everything, you're beautiful beyond belief and everything. And I just think, all I can do is thank you. Thank Devin for getting vaccinated. And thank you for your contribution to this great state. And I mean it from the bottom of my heart. I love kids beyond good sense, and have the great opportunity to be with them and everything when I'm coaching and everything. And so just go do great stuff. You're going to do it. I know you are. And so congratulations.
Thank you.
Okay. I don't know how it gets much better than that, but we really thank Paige and Devin, and we wish them the best throughout all their life and everything, and I know they're going to do wonderful stuff. Now, to get through this real quick, we have 4 more drawings. We're going to give away $3 more million. Then we're going to give away $1,588,000, and $588,000 is the second place right behind that. We've got all kinds of other things that are out there that we don't have time to run through all the names, but 25 getaways at all of our state parks is really, really, really neat. And the lifetime hunting and fishing license is great. The rifles and the shotguns, all good stuff. So register. I mean, please register. I think there's 339,000 that were registered for this drawing and everything. And you don't have to register again. If you haven't won yet and everything, you're in and everything. You're in the drawings to come, and I wish everybody the best of luck and everything. Just remember Nathan's saying, and I love it, where he said, save a life, change your life. I don't know how it gets much better than that either. So we thank Nathan again. We have now, like I said the other day, we have gone over 1 million vaccinations to West Virginians, and that's really great stuff. And that is that there's been over 1 million West Virginians now that have gotten at least their first dose. We're at 87.6% administrative rate for this week. We're at 87.3% of the 65-year-olds that have gotten at least their first shot. And we're at 79.4% of the 50-year-olds that have gotten their first shot. That's really great stuff. We're at 64.6% that have gotten one dose of the eligible population that's 12 and older. And we're targeting 90% now of all the 65-year-olds that will be vaccinated, and 85% of all 50 and above that will be vaccinated. I tell you about our businesses and churches, please get in touch with us. We'll come and vaccinate your folks, and we'll come and vaccinate your congregations or your employees, either one. The info line on the COVID vaccine stuff is all up there. The free testing map should be up there and everything. We thank Frith and we thank Walgreens for all the good work that they've done along the way. We still have 0 outbreaks in our churches. We have 5 outbreaks in our long-term care facilities. We have 1 inmate that has COVID and 2 staff people, and I encourage everybody, go give blood. Give blood. Day before yesterday, I met with Senate President Craig Blair. We discussed the situation involving the work zone on I-81 outside of Martinsburg. Last week, there was a terrible accident where 2 people died trying to be good Samaritans and everything there. It's just terrible. It's terrible. We're going too fast in work zones. We have got to slow down. Berkeley County Sheriff Nathan Harmon said it was one of the worst accidents he's ever seen in his career. He also said speed was the contributing factor to the accident. The cleanup and ensuing investigation resulted in the closure of 2 lanes of I-81 for 7 hours. All this is unacceptable. So today I am directing the West Virginia State Police to immediately begin additional enforcement of the 55-mile-per-hour speed limit in this work zone and in all work zones. And I'm also directing the West Virginia Department of Transportation to go above and beyond the national safety standards with signage and traffic controls. We will be monitoring this situation at all times, and we remain committed to making it safe in these work zones for these great folks and everything. Now listen, that's all there is to it. I know we're all in a hurry. But in sitting with our Senate President and just seeing the anguish on his face, and just hearing in the tone of his voice, that just this really, really is has gotten to him. I mean, it's just a terrible tragedy, and we just gotta. Come on, we want to fix our roads. And we sure absolutely don't want to drive on old broken up roads and all that kind of stuff. And we got to absolutely do all the great work that we're doing. But come on. you got to watch what you're doing. You just got to watch what you're doing. Just take an extra little bit of time. These great people are working really hard, and they're standing right out there, and people zooming by them and everything, and it can be tragic. So let's really just slow down just a little bit. All of us need to do that. Me included, everybody needs to watch in every way. So thanks to our president, our Senate president, and all those that are out there that are doing the great work and everything. So we're going to do better. We're going to do better. At least, we're going to try. We're going to enforce like crazy, and we're going to try in every way we possibly can to continue to keep our people safe. So thank you a bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. To reinforce some of the comments the governor has made, there is more and more concerning evidence that is mounting around the world and in the United States about the change in the activity of the Delta variant from COVID-19. And as the governor has said, that even though right now we have 15 cases of the Delta variant in West Virginia, we know that that variant is growing very rapidly. On June 16th, the Delta variant made up 10% of the cases as reported by the Centers for Disease Control in the United States. Yesterday, it was reported by the CDC that the Delta variant now makes up 51% of the cases in the United States. And in some states like Missouri, which is starting to see another surge, the Delta variant makes up about 96% of the cases. Remember, this variant is a different sort of type of COVID-19. I think it was Dr. Fauci who said this is COVID-19 on steroids. And we know, as the governor said, that this particular variant really attacks people that are not vaccinated or people that are partially vaccinated. So being completely vaccinated is very highly protective against you getting COVID-19 or you getting sick with COVID-19. We had also talked in the past that children were not affected nearly as much as adults. That is actually not true anymore with this Delta variant of COVID-19. In a camp, an overnight camp in Georgia, one counselor got sick and was tested positive for COVID-19. They then tested all the kids there, and there was about 600 kids there. Of 344 tests that were evaluated, about 250 were positive, and the most common group of kids to be positive in that study were children from 6 to 10 years old. So we know now that this variant, the new variant, the Delta variant for COVID-19, can infect children just like it can infect adults, mostly unvaccinated. It's also really important to recognize that this variant in adults is really, really problematic as well. And in the state of Maryland during the month of June, every death that they saw from COVID-19 were in unvaccinated people. And around the country, it's about 98 to 99% of the deaths we see around the country are in unvaccinated people. And also some of the deaths, very, very small percent, in partially vaccinated people. Fully vaccinated people are really very protected, even with the Delta variant. So this is an opportunity, and we've said this now many times, where in West Virginia, we have a view of what's going to happen. The Delta variant is going to be the most common variant in West Virginia. This variant will make people who are not immunized much sicker than the previous variants will, and it's going to infect people more easily, including children. So we absolutely call on each West Virginian who is vaccine eligible to please get fully vaccinated before that variant comes and really sets up shop in West Virginia. And for our children, for our younger people who are not eligible yet for vaccination, let's make sure that we're doing a really good job in protecting them and making sure we're not exposing them to very high risk environments. Thank you.
Thank you, Dr. Marsh. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. Retired Major General Jim Hoyer and Dr. Anamjad had prior engagements, and they will rejoin us next week. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I'd like to go back to what Dr. Marsh just said. Could you elaborate a little bit more on how parents can protect young children in light of the spreading Delta virus and the fact that kids can't be vaccinated yet? What do parents need to be doing?
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. So to me, a few of the really important elements for parents to protect their kids is to try to avoid crowded places where there's people that you don't know and don't know have been vaccinated. In those kind of settings, the risk is higher. Indoor settings are always more risky than outdoor settings. Settings around a lot of people, particularly people that have not been fully vaccinated and are not 2 weeks after that vaccination, are higher risk. And I would really encourage parents for children who need to go in those kind of environments to have their children wear masks if they can and stay physically distanced from people and avoid people that are sick. Wash your hands, exactly what we instructed people to do before all the vaccines became available. We're also very optimistic that clinical trials will demonstrate the safety and the benefit of these vaccines for younger children very soon. And we believe that more and more children will be eligible to be vaccinated at younger ages in the relatively near future. But until then, parents need to focus on the mitigation measures, the power that we all have, mask, physical distancing, hand washing, and really avoiding high-risk situations.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Sorry about that. Good morning, everyone, Governor and cabinet members and fellow reporters. It's kind of a COVID-related question, and I want to address it to Bill Crouch. There is a big fundraiser going on or concluding today that its objective is to raise a lot of money to promote and encourage foster care in West Virginia. And I know that's been a big concern of yours and the legislatures and the governors. And with the COVID-19, we've seen a spike in opioid problems again in the state. They're directly related to the isolation and the depression brought on by COVID. Are we seeing a spike in the need for foster care and foster parents and foster families because of the spike in opioid use because of COVID-19?
Secretary Crouch, if you could handle this, sir.
Yes, sir, Governor. Thank you. That's a great question, Mark. We have always seen increases in the need for foster care related to the amount of SUD use in the state. I've talked before in the past about those trends being parallel trends. As we see increases in substance use disorders, we see increased need for not only foster families, but other services. We call those wraparound services for children who are in foster care, or that we're now trying to keep through the Family First legislation, trying to keep at home with their families by providing other services rather than have to move those children out of the household. So those are both very concerning problems. As you know, the isolation and the loneliness and the lack of support for folks throughout the last 18 months has caused an increase in overdose deaths. We're monitoring that. The Governor's Council on Substance Use Disorder has continued to meet and has several initiatives, as well as the Office of Drug Control Policy, which in essence staffs that council, is working very hard to develop additional quick response teams, additional lead programs, trying to get more and more individuals into treatment who have SUDs. So we're putting on a big push to try to increase those services everywhere, as well as the efforts we're doing at the governor's direction with regard to taking care of our children in West Virginia. We're working real hard with the legislature as well to try to make changes in the child welfare system. We're making great strides there. So thanks.
All right, thank you, Mark. Governor, I'll turn it back to you.
Well, I'll end this thing up and everything with this. I go back to to Dr. Marsh, speaking to us. He's our coronavirus czar. And Dr. Marsh is an incredible man with unbelievable medical intelligence and intelligence in general. And he's guided us in many, many different ways here. But he keeps telling us the same thing. He tells us the same thing about this Delta variant, and I just want to go over this. I just want to say this just so bluntly. If you choose in life not to get a vaccine, or you choose in life for your children not to be vaccinated and everything, that's your choice, and I totally respect that. And I don't want to be here trying to talk anybody into getting a vaccine or doing anything that they choose in life that they don't want to do. I get that. All I'm here trying to do is educate you. Educate people that this is my opinion. This is our coronavirus czar's opinion, to the very, very best that we can possibly give you. You see, at the end of the day, I'm not wanting to impose in your life in any way. I don't believe in that. But I absolutely want to be your governor. And I absolutely want to try to protect West Virginians as best I possibly can. Now, just take heed just a couple of things that Dr. Marsh has already said over and over and over, And really, if you'll just think about it, we think, well, what about this Delta variant? Well, we know that it will kill you twice as easy. And we know that it will make you twice as sick, or surely some significant degree. We know by Dr. Marsh that I didn't know until he just came on just a second ago and said, over 50% of the cases in the U.S. today, the new cases, are related to the Delta variant. And he said in Missouri, I think he said in Missouri, that 90% of the cases are some way tied back to the Delta variant, or maybe 90 plus. And maybe I didn't hear that exactly right. He also said that this Delta variant can really jump on kids, did he not? And he said that there was a camp, and at that camp there were 600 kids, or 600 people. And they tested 344 of them, and much to everybody's surprise and astonishment, I'm sure, 260 plus of them, or some number like that, tested positive out of 344 tests. Now, he also said this, that every single death in the state of Maryland in the month of June, every one of them, the people that died had not been vaccinated. Now, to me, it's my job to educate, isn't it? It's not my job to absolutely go get your hand or knock on your door. I mean, that's ridiculous in my book, and say, we're here to give people vaccines. Can we give you a vaccine? We're not going to do that. I think that's ridiculous. But it's my job to educate. It's my job to try to tell you and urge you the very best that I possibly can. I'm telling you, just straight up as straight up can be. This variant is coming to West Virginia just like Dr. Marsh said it's coming. We hope and pray it's going to be less than what we expect, but absolutely we know without any doubt that if you get this, it will cause significantly greater consequences, maybe death, maybe sickness, whatever it may be. So you get sicker, people that with this, they die easier, and we know it can affect our children even more. Now, again, choice is yours. Choice is yours. I'll respect it either way. I feel safe myself. I know the people that are around me, my family's all vaccinated and everything. And, so at the end of the rainbow, I would tell you, you make the choice. There's no question that this thing's here. There's no question that in the month of June in the state of Maryland, every single solitary person that died wasn't vaccinated. It's an easy choice in my book. Nevertheless, I love you, and we're going to keep trying with all in us. Absolutely, you've got to always remember, and I mean, I am proud of you beyond belief, and I absolutely mean it when I tell you that I love you. You know, the people of West Virginia are the greatest, period. That's all there is to it. And you know, this state's on the move, and we're doing good stuff, and that's why, you know, I just want to try to do everything I possibly can at all times to help you, to try to protect you, to do everything I can. And now we got one thing that we missed with the kids. We got the 2 kids that won the scholarships, and we're going to give this away really quick and everything. But if we've got them back, and let's see if this is Devin or Paige. This is all right. This is you, Paige. Okay, we got one of these coming to you. It's got "Do It for Baby Dog." It's got Baby Dog's picture and everything. It's a backpack and everything, and then one of these is coming to each one of you, and I'm going to read this and everything. It says, "State of West Virginia, do it for Baby Dog. Save a life, change your life." Now, I'm going to put this over here. Okay, it says, "Greetings, be it known that Paige Stanley," and I forgot Devin's last name. Hold on just one second. I'm gonna read it all at the same time. Well, I'll do them both. It says, "Greetings, be it known that Paige Stanley, Parkersburg, West Virginia, is hereby awarded this full 4-year scholarship to be used at any public institution in the great state of West Virginia." It's got Baby Dog's paw print and signature right there, and my signature right there. So Paige, this is all coming to you. You pick later on your life and everything, and good stuff. Now I'm going to read Devin's real quick. Says the same thing, Devin. You've got this coming to you. Do it for Baby Dog. And it says, "State of West Virginia, do it for Baby Dog. Save a life, change your life. Greetings, be it known that Devin Dawson, Alma, West Virginia, the great town of Alma, West Virginia, is hereby awarded this full 4-year scholarship to be used at any public institution in the great state of West Virginia with Baby Dog's signature and my signature." So Devin, it's all on the way. Congratulations, son. Way to go. Paige, congratulations to you. Thank y'all so much for getting back on. Thank y'all. All right, we're out of here. Thank y'all again for everything.